Modilon General Hospital has a bed capacity of 260 that can accommodate up to more than 11,000 admissions in a year. 56 of the beds are allocated to the 3 TB wards. Public health specialist Dr. Billy Self says for now at least half of the bed spaces have already been occupied by TB patients.
So if Papua New Guinea can really take the attention away from just the curative side of it, to engage more the education people, the primary healthcare, the primary industry, and all other sectors to be involved to know that tuberculosis is caused, we become prone to the TB bacteria because of our body immunity. We're not able to fight infection. Number one. Number two is people overcrowding and they're exposed to the bacteria in big numbers continuously, and that's why they get infected.
Physician Dr. Weston Nambut says the increasing number of TB patients occupying the bed space is an extra problem on the availability of resources at the hospital.
We got only a limited number of beds here. We can't keep all TB patients here just to get their treatment completed for 6 months. That is going to be a huge stress on the bed space that we have. So once they're stable enough, we release them. So on that end,
but the two doctors say one of the wards is interconnected and it housed other patients as well. On this side are TB patients. The other side is the drug-resistant TB patients. A wall separates them. Dr. Nambut explains patients with drug-resistant TB are supposed to be isolated from other patients, so the risk of transmitting the bacteria is low. But due to the current arrangement, the risk of TB bacteria spreading is high.
We've made some budgets and sent to government, but I think they were not able to assist us. So we're still handling on, trying, and this is one of the reasons why we are not able to start opening up the isolation ward. We have everything done, infrastructure, beds, all things, but we were not able to find the money to start isolating the patients. And we're also mindful that when we have the other form of tuberculosis, which is resistant to all drugs, we need to create another ward again. And this is another thing that we also, at the back of our mind, how are we going to do it when we're struggling still with creating a ward for it in the medical.
The Modilon General is the Level 5 provincial referral hospital that serves more than 500,000 people. The hospital has 432 workers. Dr. Billy Selv says they have a ward ready to isolate the drug-resistant TB patients, but due to financial difficulties, they were not able to get permanent staff to work. Mata Luis, National EMTV News, Medang.